Willis. At the Parkdale Activity Recreation Center, we're trying to develop 29 units of affordable housing. But of course in Parkdale, many of the people who live there live in affordable housing because it's cheaper than the average market housing across the city. So a lot of the housing that's in Parkdale, especially South Parkdale, there are about 33,000 people who live in South Parkdale, and about 94% are tenants. So and they all live in mostly private market housing, and it's got some challenges. It's small. It's not well kept up. There are extra fees for it. Nonetheless, it's there, and it's an opportunity to develop housing. So that's the context under which Park works. But one of the things is that there are broader pieces here, and as we're going to go forward next week and go to the consultation, and as I hear from the folks around this room and other rooms, and the ongoing sort of where are the vision statements about what we hope to achieve here? Affordable is affordable is affordable. And I don't, the difficulty with that 200-page document that TCHC uses, and that, if you talk to people at ONFA or at CHRA for the Canadian Housing Renewal Association, there are many programs that have been put into effect that have been left and then are hanging, and you've got to add on to it, and they become impossible to administer. You need to be a wizard as far as numbers go. And the rest of us, simple people who just want to be able to afford housing, have no idea how to, in fact, fit the criteria. So if you're going to have a long-term affordable housing strategy, it just has to be affordable, and we have to figure out and to say, this is what affordability is, whether it's 25% or whatever. So Michael, I like that. Philip, I heard you on Monday at the mental health, the 10-year strategy for mental health and addiction. What's obvious about this as well is that there is a disconnect between MCSS, the Ministry of Community and Social Services, who end up paying for a lot of housing and who help support people with disabilities. Then you've, of course, health, a huge player as far as supportive housing goes, and now we've got the Ministry of Housing, and they're going to do a long-term affordable housing strategy, and I don't get the sense that they're actually talking together. So that when you have a sense that you want an affordable housing strategy, that affordable housing strategy, that affordability, what you're hoping to achieve, actually spans all of those ministries and silos. So I want to close with this final piece, and that is that I want you to actually think about a vision of a world where you're not at the bequest of a landlord, but in fact landlords are clamoring to get you to rent their place. Landlords that actually are saying, look at my great new unit, it's here, it's cheap, it's affordable, please come. Well, what's that about? Well, that's about supply. So the reality is we need investments to be made. We need to have a supply that actually exceeds demand. Yes. So that then when a place has a flood or something goes on, people don't end up in shelters, but in fact can be moved to another unit, and where we have the kind of investments and the kind of society that we want to achieve that is based on an appropriate supply of one of these most basic and fundamental rights, which is housing.
I'm Jack Cattell. I'm not affiliated with any particular group on this issue. I just want to pick up on a couple of points that were made. I independently was going to advocate here for the 10-year issue being an important issue. It's not just a matter of the amount of the subsidy, the amount of money. It's also the where you live and the amount of empowerment that you have in your lifestyle, including housing. It seems to me when I talk to people in rental housing and in co-op housing, the people in co-op housing are happy, they're content, they feel in control, they're proud of where they live. The opposite, that's not true with people in most market rental housing. And I say, well, how did this happen? Where did this start? It goes back to the early 90s, when a number of buildings, not enough, but a number of buildings were private rental buildings, and then they became co-ops as a result of government assistance. And I don't know the details, but obviously there was money and legislative changes. And I asked the question: why can we not bring back some of those programs that allowed people in market rental housing to take control of their accommodation? Because those people are going to be more content, they're going to be happy, they're going to be better citizens, better able to look after their kids, and more affordable because they'll be able to control the costs better. So let's raise those issues as well. It isn't necessarily the real marginalized people, but the ones in the next level. That let them move up and let them take control of their accommodation.
You lived in a co-op. And I talk from the affordable housing framework of Toronto Community Housing Corporation because that's where I've lived for 20 years. But just to kind of tie into that and basis and data, one of the points I had that I omitted because of length of time was ensuring that the strategy, when we bring in the points of the consultations, reflect a flexible affordable housing model to ensure the ability of people aging in place to have long-term security of tenure. I'm associated with a number of disability organizations within Toronto. One within Toronto Community Housing Corporation, the Andy Abelson Committee, and ERDCO, Ethno-Racial People with Disabilities Coalition of Ontario. These are both, bringing it up, glad you mentioned it, real big issues, because within Toronto Community Housing Corporation alone, they have 58,000 odd housing units, only about 30% of which at the moment can be made accessible to the level of needs for people aging in place. And that's what they could effectively bring up to standard. There's some things that you can't change, like buildings without elevators that are walk-ups, and just old models of housing that's 35 and 40 years old that can't be adapted. So as people are aging in place and becoming disabled, becoming elderly, right now issues of transfer and security of tenure, even within a housing model that's considering it, is becoming problematic. And then you take issues of people who aren't living in affordable housing, living in the private rental market, where there is no assistance and you have problems with having to get help for adaptations through agencies and foundations. A lot of that as well, I think when we're going into these affordable housing consultations, we should be asking for partnerships. We should be asking for that aging in place strategy both within the affordable housing that's built, as you say, and what's created, and looking for long-term planning to change some of that sustainability. Toronto addresses it in the Housing Opportunities Toronto Plan as well. But again, that would be a partnership framework where we look at the Toronto model with the Ontario. We look at the feedback from agencies, from groups like ours, and tenant feedback. And again, these are the things that I would encourage people need to take to those issues. In respect to the income, again, using Toronto Community Housing as an example, only about 30 people in Toronto Community Housing, only about 30% are on social assistance of some kind. You have another 30% or more that are the working poor. I think a lot of that's personal choice, but I do know from people I've talked to, a lot of people would like a model in place to be able to own housing. And again, as personal choice is something to take in, I think the majority would rule on going in. I'm not going to comment either way, kind of how I feel about it. I have mixed thoughts. Too long for our time. Yeah, good. But I think, again, taking it in for the people who want to talk it from experience, from their income, from their personal, is a good thing to do. Thank you. On the panel.
And also the violence that you hear about in social housing, a lot of times the people in the social housing, they're the victims. They're not necessarily the people who are causing the violence. So that's not always...
I have to say, I live in Toronto Community Housing and have lived in a shelter before. But one of the things I find most difficult is everything looks glamorous on paper, but when it comes to the actual reality, it is not connecting. Things get, there's a disjointment. For example, we tried to start a rooftop garden, and we got a lot of runaround. So I told the tenants, plant the seeds, put in what you want. Now we have lettuce coming up, herbs and different, herbs coming up, and people are going up there and getting what they want. They're asking this, one guy was asking, does this go in spaghetti? And, can I put this in my pasta sauce? But one of the most important things I'm seeing now is the community is more engaged, the community is more connected, and I think these are one of the most important points for the tenants is to feel a part of their community, to feel respected, and to